So when your high flow device, like non-rebreather, it seems to be working on your patient, but your patient wants to eat, and your patient wants to go to the bathroom, and your patient wants to get up and start being more active, then what you need to do is transfer them to a high flow nasal cannula. We have a specific device, okay, that we fill to the max level, okay, with sterile water, okay. We hook it to the flow meter just like this. And it has its own special nasal cannula. This nasal cannula is a specially designed large bore. It's a little bit bigger than the other one, but it fits the same way. It's real soft on the face. It's not like it's rigid, okay? See, it's really soft. And you would hook this to here, turn this flow meter up to whatever you had your non-rebreather on, and then you can drop it down a little by little until you get them down to about 4 or 5. And once you get it to about 4 or 5, then you can transition them to the regular flow meter, okay? So there's that. Now we're going to talk here just a minute.
How many liters total can you go up to on
2 to 15.
2 to 15.
We're going to talk about oxygen delivery devices now for medication delivery, okay? We have the nebulizer, okay? So the nebulizer fits on a mask or a mouthpiece. Some of your patients don't like masks and they will not want a mask, so you would put them on a mouthpiece, but you have to make sure that they're able to hold it in their mouth correctly, okay? So some of your patients do better with just putting the mask on. You would go ahead and put the medicine in the cup. You can leave the lid on it, tighten it up, and put the medicine in through the top of it so that you don't have to open this cup up to air, okay? So you put your medicine in and you attach that here, and you attach this to the flow meter. You don't attach it to the tip of a humidifier. You attach it directly to the nipple on the flow meter. And this one runs 7 to 8 liters, okay? 7 to 8 liters, okay? And depending on how much medicine that you have in here, if it's one dose or you're giving an albuterol and an Atrovent, it will last probably 10 to 12 minutes, okay? Depending on how much liter flow you give it, okay? So that would be how to deliver nebulized medicines. You can always deliver nebulized medicine through a ventilator or through the BiPAP using what's called an aerosol T. And it fits into the T of it, just like this. It fits in line with your circuits, and you just slip it in and run it in, okay? So we can do that as well. Now, if your patient is just having the MDIs or meter dose inhalers, we have several different kinds. You have the Ventolin, and you have the Aerobid, and then you have some other ones that are deliverable through an aero chamber, okay? So once you open your MDI, okay, it fits at the back of the aero chamber, okay? These are also called spacer devices, okay? Now, when you hand this to the patient, you'll pop off the top. This is where the mouth is. The mouthpiece goes here. You make sure you shake that up really good, okay? You hand it to the patient. If the patient's not real strong in their hands, you can actually give them a puff and then have them take a deep breath through there. The aero chamber device holds the medication in here that allows the patient to take that slow, deep breath, that without having to go real fast, like, okay? And it all gather at the back of the mouth, okay? So remember to always, when you use an metered dose inhaler, that you're going to also use some sips of water afterwards, okay? Now, some of your metered dose inhalers are the dry powder ones. They do not have the same type of thing. There is a dry powder that once you open the lid, it kind of flips open, like Advair, Trilogy, Brio, Brett Street. They're all the same way. They're dry powdered. You open them up by moving the lid, and once that lid moves over, it releases and punctures a tablet in there that creates a fan that when you inhale, that fan will pull that up into your mouth. So that's how those work, okay? So remember, after every metered dose inhaler, when you finish with your dose or two, however many you give, they must rinse their mouth, okay? Rinse, swish around, and spit it out. If they want to swallow it, many patients will. It doesn't hurt them. Just make sure they drink more water to get it all the way down. Okay? Pause it.